On February 24th, new regulations took effect that limit access to government benefits for many immigrants. The goal is to set a new standard for screening out people who would be a public charge. The changes affect people applying for entry to the United States as well as for permanent residency. To tell us how the changes affect access to health care is our guest from the advocacy group Healthcare for All, the Director of Communications and Immigrant Health, María González, Albuixech. Thank you very much for being with us, Maria.
Thank you so much for having me.
Maria, I want to ask you at the outset about the kind of people these things affect, because a lot of viewers might say, oh, those are immigrants who are on welfare, they're not working, but is that really true?
It's actually not the case, but I'm going to clarify something first. This is not about limiting benefits or access to benefits. Immigrants, for the most part, do not have access to the benefits that they have added to this rule, and we can go into details. And the truth is, this rule actually impacts people who want to apply for a green card. And the new factors that they have added to this rule to determine if somebody is going to be depending on the government, they have added some benefits such as Medicaid, SNAP, housing. These are benefits that immigrants who are applying for green cards do not qualify for to begin with. So I just want to make this clear. This is a myth. This is propaganda. This rule is not about limiting services and the access to benefits. It's actually imposing a wealth test on hardworking families. And you're very right. These are not immigrants that stay home receiving benefits. These are immigrants who are hardworking, who are not even eligible for these benefits.
What about people who, let's say, might have a job right now, not making a whole lot of money, working very hard, and they do need some health care? What are the options out there for them?
Well, they have many options depending on the immigration status. In this case, I want to clarify that this rule actually does not limit the access to health care. What this rule does is it looks at a lot of circumstances, what we call the totality of circumstances, and it says that the person may be depending on benefits in the future. So right now, if an immigrant has a specific immigration status that allows them to apply for a green card, they probably can access, for example, connector coverage. And connector coverage doesn't even count towards the rule. So there are many, many options to access different healthcare services, depending on your immigration status. If you have a better immigration status, you have more comprehensive services.
Now, one of the other things that occurs to me that you could be working hard, not making a whole lot of money, and the government says, well, in the future, we don't think you're going to make enough money to get a green card. What does that mean for people?
This is what the rule is about. That's what the rule is. That's why the rule is so dangerous, because what it does, it imposes an income eligibility wealth test, technically, and it tells people, if you're not making enough money, we don't want you in the country. What it does is people are very scared already. There's what we call the chilling effect. It doesn't matter if you are on the benefits that we talk about. It doesn't matter if you're even applying for a green card. People are dropping benefits, not accessing health care that they're entitled to. And what it means is really a risk for all of us, because people need access to benefits such as nutrition. They need access to housing, and they need access to health care.
Now, one of the benchmarks I heard about was that they want people to make 250% of the local poverty level, and
Correct.
I think around this area, that means, what is it, $65,000 a year for a family of four?
63,000, yes.
And I guess there could be a lot of families, you know, they're really doing their part, but they're not up that high.
No, in fact, the percentage of families that would meet that criteria is very large. However, we want to make clear that this is only for people who are applying for a green card and who don't have exempted statuses. So if you look at who is really impacted by this rule, it's actually a limited amount of families. And that's what I think our effort is right now, is to ensure that people that shouldn't be worried are not running away trying to cancel benefits that they're entitled to. But you're very right, 250% of the federal poverty level, that's not poor or very low income. That's a hardworking family who's middle income family. $63,000 a year for a family of four. It's not that low income.
What things are you afraid that people are going to turn away from just out of fear, and that they should be able to do?
Well, because I work at Healthcare for All, I can tell you we're very concerned about people not using health services, not applying for health coverage or health programs that they qualify for, and therefore not accessing the health services they need. Preventive care, for example, right? Immunizations, for example.
Right, because I saw non-emergency Medicaid on the list of things you have to be careful of. Now, these days, with all this fear of coronavirus, people might catch that and think they've just got the flu, and then they're going to say, oh, I'm not going to see a doctor now because what if it isn't coronavirus? I mean, what goes on in somebody's head like that?
So, first of all, is non-emergency Medicaid is the only program that's included. In order to apply, to actually qualify for non-emergency Medicaid, you already have to be a green card holder for more than 5 years, which means you're not subject to public charge, which means people should not be dropping benefits to begin with. Now, when we go back to this chilling effect and how that relates to healthcare, in an environment like the one this week, we had this crisis about the coronavirus coming our way. What it means is people are not going to go seek the services that they need in preventive care. For example, that early screening that can be critical to make sure that somebody's isolated. They're definitely not going to go to the doctor to do that, and that puts everybody at risk. There's a population health issue here, which is we live in a community, we're not isolated. If we don't provide services to people who need health care, what happens is that impacts all of us.
By the way, if people need some more details about this, is there a way they can seek that out and maybe get some answers, not just in English?
Absolutely. So on our website, Healthcare for All, hcfama.org, we have a whole tab that's immigrant health. And there we have information on public charge in 13 languages. So I think we covered a lot of our populations, and that it specifies who's subject to public charge, who's not subject to public charge, which programs count, which healthcare programs count, and which don't, and also resources about where to call to talk more with an immigration attorney or public benefits attorney in order to understand how that impacts their specific case.
Thank you very much for being with us.
Pleasure so much.
From Healthcare for All, María González, Albuixech. We'll have more news in just a moment.